Welcome to Rebel Justice. Today's episode weighs heavy on our hearts. It's the story of Khadija Sennai, a woman who endured unimaginable suffering while trapped in a system meant to protect and care for her. Instead, she faced neglect, cruelty, and indifference, all of which contributed to her untimely death in March 2025. Behind every heartbreaking detail of Khadija's suffering stands a family shattered by her loss. Her two children, both in their early 20s, they watched helplessly from the outside as their mother's health deteriorated, powerless to intervene or protect her from the neglect she faced behind prison walls. But this is more than just one person's tragedy. It's a stark reminder of the deep-rooted failures in our prison healthcare system. Failures that strip vulnerable people of their dignity, their health, and too often, their lives. Khadija's story demands our attention, not only because of what happened to her, but because it is a symptom of a broken system that continues to fail many others. Khadija was a fighter. Diagnosed with stage 4 stomach cancer, she was battling not only a deadly illness, but also a system that repeatedly turned its back on her. It began months earlier, when she first sought help at St. Peter's and Ashford hospitals. Despite showing clear symptoms, she was met with refusal and dismissal. No thorough investigations, no urgency, just delays that allowed her cancer to advance unchecked, stealing precious time from her and her loved ones. Imagine the anguish of feeling something wrong inside your body, begging for answers, only to be ignored by those sworn to heal. By the time she finally received an MRI and further tests, the tumour had grown too large. Her options of treatment severely limited. A devastating diagnosis that, if caught earlier, might have been treated differently. But Khadija's ordeal only deepened inside the walls of HMP Bronzefield. Here, instead of receiving care and compassion, she encountered neglect and cruelty. Prison staff, including those responsible for her meals, deliberately denied her adequate nutrition. Despite severe difficulty swallowing and a clear medical need for a special diet, she was given liquefied food, described by her fellow inmates as foul and insufficient. Her body wasted away. She went from a healthy 86 kilograms to a frail 49 in just a few weeks. Fellow prisoners watched helplessly as she shrank before their eyes, her cries of pain dismissed or barely treated with ineffective ulcer medication. There was no one to advocate for her, no one to listen. When she fainted and could no longer leave her bed, only then was she taken to hospital. Still handcuffed and shackled, a humiliating and degrading sight for someone so sick and vulnerable. This treatment flies in the face of medical guidelines, which stress that seriously ill patients should only be restrained if there is a clear and immediate security risk. Even as chemotherapy ravaged her body with nausea, vomiting, and dizziness, support was minimal. Her condition worsened, complicated by a dangerous blood infection that went untreated. Khadija was left in unsanitary conditions, unable to care for herself, relying on the kindness of other prisoners to feed and wash her. Through all of this, the social care she so desperately needed was denied. Despite contracts in place between prisons and local authorities to provide adult social care, Khadija was never referred for any support. She was left to face unimaginable suffering. Even when her health was clearly failing, she was repeatedly denied bail during extradition proceedings to Italy. Her lawyers, including prominent law firms, appeared ineffective in advocating for her. Crucially, her diagnosis was never shared with Italian authorities until it was too late. When the extradition request was finally dropped, Khadija had already endured 9 months of torment in prison. We are now going to hear the words of a prisoner who lived with Khadija throughout the spring and summer of 2024.
When Khadija came to house block 3, she was put on a spur. She was always in her cell, and she had to get help from her cellmate and other women on the spur. She couldn't clean, she couldn't feed herself. She never left her room unless she was going to meds. With the help of her cellmate, we knew she couldn't keep the food down, and she was weak and in pain. But no one really did anything, and nothing used to happen. One day, She was taken into hospital by ambulance, and we all got locked behind our doors during this because they didn't want us to see how sick she was. After she went into hospital, we found out she had stage 4 stomach cancer. Months later, I remember seeing her, and she looked much better. She was able to walk on her own without her cane and with no help, which showed that maybe if she had been taken to the hospital way before, she could have got help she needed. I worked in the kitchen, and we were told to just blend everything on the menu that she chose, and we didn't do anything special for her. Once in a while, she was sent a shake. That's what kitchens used to give her with mild seasoning, because of her stomach cancer. It's such a shame she's died. She was a lovely woman, and I'm sure her death could have been avoided if they just helped her before.
Khadija's story is tragic, but far from unique. Data shows prisoners of cancer are 28% less likely to receive curative treatments and have a 9% higher risk of death compared to the general population. Early diagnosis, timely referrals, and ongoing specialist care, cornerstones of cancer treatment, are often missing behind bars. Watchdog investigations reveal a grim reality. Between 43 and 48% of prisoners miss outpatient appointments. Women in particular suffer indignities, such as being handcuffed to male guards during hospital visits, practices that deter many from seeking vital care. The Rebel Justice podcast previously spoke to Jo Arms, Professor of Cancer Care at the University of Surrey. In this conversation, we explored the systemic failures that prevent incarcerated women from receiving cancer care, equivalent to what's available in the community.
One of the things we found was that part of the decreased survival rate was because people were less likely to be diagnosed through screening or through the 2-week wait referrals. So I think a key way to improve survival in that population is to kind of more earlier diagnosis. So improving uptake of screening. That's some of the prison systems really help with the screening programs though, because of the churn within the prison system. You know, people being moved around a lot, so they might start the screening process, require an extra investigation, but in the meantime they've been moved to another prison.
You can listen to the full interview on episode 76, titled Grace Colburn Part 2, The Right to Dignified Cancer Care. The Parliamentary Joint Committee on Human Rights has repeatedly criticised prison healthcare services for treatment delays, failures to follow up on abnormal test results, and a lack of responsiveness. Reports from HMP Bronzefield itself expose a history of neglect and poor care that eerily mirror Khadija's experience. Behind this failing system are corporate and institutional actors whose accountability must be demanded. Sodexo Limited manages healthcare services at Bronzefield, subcontracting clinical services to the CNWL NHS Foundation Trust. Both have come under scrutiny for repeated delays and failures to provide timely, adequate care to prisoners. Local hospitals discharge Khadija without proper care plans or social support arrangements, in violation of healthcare regulations and basic human rights. This chain of negligence, from hospital to prison to social care, sealed her fate. After her release, Khadija faced the daunting task of navigating the healthcare system alone, still battling pain and illness. Less than 6 months later, she died. Her death has ignited calls for a full corporate manslaughter investigation and demands the government terminate Sodexo's contracts in prison healthcare. The Rebel Justice podcast has reached out to Sodexo, the CNWL NHS Foundation Trust, the Care Quality Commission, and HMP Bronzefield. As of this recording, we're yet to receive a response from the CQC. However, we have received disappointing responses from all others. Louise Stead, Group Chief Executive of Ashford and St Peter's Hospitals and Royal Surrey NHS Foundation Trusts, where Khadija was treated, responded,
In this case, no internal review was initiated, as no issues or concerns were identified within our clinical pathways or during the patient's care.
However, We know that St Peter's and Ashford Hospital discharged her with no proper care plan in place. This is against the law. It's against a woman's basic health rights. Sodexo responded with the following.
While we do not comment on individual circumstances, we can clarify that healthcare services at HMP Bronzefield are commissioned separately by NHS England and are operated by a different organisation. As a general principle, prisoners are not treated any differently regarding their medical needs, whether they are on remand or convicted, and can expect a level of medical treatment equivalent to that which they would receive in the community.
But we want to remind you of how Khadija was treated in prison. Nurses, noted specifically Stacey Close, told Khadija to stop complaining and gave her medication for stomach ulcers, completely undermining her pain and discarding her suffering. HMP Bronzefield features a training cafe, Vita Nova, which can be used by the officers and enhance prisoners by swapping 5 good behaviour incentive earned privilege slips. A staff member prevented Khadija from accessing Vita Nova. Khadija was supposed to receive a special diet from the prison kitchen to aid her illness, particularly as she now couldn't swallow. However, the kitchen manager told the prisoners working in the kitchen to liquefy her food and stick it in a container. The food is repulsive, and Khadija couldn't eat it. Khadija tried to get some food from the servery, but the prisoners on the server were told by Christine Morrison, then the house floor manager, that she was not allowed to. Khadija's weight sunk to only 42 kilograms while she was undergoing chemotherapy to try and shrink the massive tumour in her stomach. All this while she has no access to vital and suitable food and nutrition. Khadija was handcuffed to officers on the way to hospital and during the treatment, including overnight stays in the hospital. Policy states that prisoners visiting hospitals with life-threatening illnesses or who are receiving treatment such as chemotherapy should not be handcuffed on the way to the hospital, let alone in the hospital, unless there are specific risks identified for a risk assessment completed by healthcare staff. This case demands more than blame shifting. It demands accountability. It demands transparency. It demands systemic reform that puts human dignity and health above cost-cutting and bureaucracy. The podcast reached out to the PPO, the Prisons and Probation Ombudsman, saying that The View magazine intends to support a clinical negligence claim against CNWL NHS Foundation Trust. The PPO responded on the 11th of July that this has been passed on to the relevant team and a response will be sent to us shortly. We hope for a further response soon and that this heartbreaking case is taken seriously. Khadija Sennai's story is heartbreaking, an emblem of systemic cruelty and neglect. It reminds us that behind every statistic is a human life, a family shattered, and a future stolen. It is a call to action for all of us, to listen to the unheard, to fight for those trapped in invisible suffering, and to demand justice for Khadija and countless others like her. You've been listening to Rebel Justice. Khadija's death was preventable, and so many others remain at risk. Sharing her story is one way to shine a light on the darkness. Join us in calling for accountability and reform, because every voice counts. If you'd like to support our work and receive 4 digital editions and 1 print issue a year, subscribe to The View for just £20. Make sure to follow us on our social media. We're on Instagram at @the_view_magazines, and you can also find us on LinkedIn, X and TikTok.